It is acknowledged that there are large variances among the health of Indigenous Australians compared to non-Indigenous Australians, and for Indigenous women's health this is no different. The Australian Bureau of Statistics have estimated that Aboriginal and Torres Strait Islander females born within 2005 to 2007 are expected to live to only 73 years of age, while non-Indigenous females are expected to live until 83, accounting to a 10-year difference in life expectancy. Indigenous health is governed through the holistic approach to health, as their social and emotional health underpin their overall. Women hold a stable role within Aboriginal and Torres Strait Islander society as mothers, grandmothers and wives. However, it is the social determinants of health which control Aboriginal and Torres Strait Islander women's health. The social determinants which primarily affect women's health include socio-economic, early life and social exclusion. These present challenges to Aboriginal and Torres Strait Islander women, highlighting the key issues such as education, income, access and opportunity. There is a disproportionate burden of adverse perinatal outcomes for Aboriginal and Torres Strait Islander mothers and their babies, including increased maternal mortality, preterm birth, low birth weight, and perinatal death. A lack of education on women's health can result in the high incidence of Aboriginal and Torres Strait Islander women smoking during pregnancy. In 2011, Indigenous mothers were 4 times as likely as non-Indigenous mothers to have smoked during the course of their pregnancy. The primary outcome of smoking during pregnancy results in low birth weight and premature birth. Babies born to Indigenous women in 2010 were twice as likely to be of low birth weight than those of non-Indigenous women. Geographic location presents a large issue regarding Aboriginal and Torres Strait Islander women's health, particularly surrounding screening and preventative measures. A lack of resources in rural locations lead to an undiagnosed incidence of leading diseases prevalent to Aboriginal and Torres Strait Islander women, as well as it hinders their ability for these women to access appropriate antenatal and childcare. Indigenous women generally access antenatal care later in pregnancy and less frequently than those who are not Indigenous. In 2012 to 2013, more than 2/3 of Aboriginal and Torres Strait Islander women were overweight or obese. Women with a high BMI, higher than 30, are at an increased risk of obstetric complications within their pregnancy and birth. Other challenges Aboriginal and Torres Strait Islander women are faced with when accessing healthcare involve culturally incompetent care, subject to racism and prejudice. A culturally competent maternity service is the key to improving maternity care and good health for both mother and baby.
In 2008, the Australian government implemented the Close the Gap policy and signed the Health Equality Summit Statement of Intent. Formal commitments were made by all Australian governments and the Queensland Aboriginal and Islander Health Council to work together to reduce the gap in inequalities that exist between Aboriginal and Torres Strait Islander populations and non-Aboriginal and Torres Strait Islander people in a number of health, education and employment outcomes. Essential targets for improving Indigenous women's health and well-being in relation to pregnancy include closing the gaps in life expectancy, childhood mortality and education. To ensure achievement of these targets, there are a number of Australian policies, standards and legislations that have been implemented to improve women's health and well-being through improved maternity services for Aboriginal and Torres Strait Islander women in Australia. Firstly, by working collaboratively with Indigenous leaders, mothers and families, the Australian Government developed the Implementation Plan for the National Aboriginal and Torres Strait Islander Health Plan 2013 to 2023. To address the changes needed to make the Australian health system more comprehensive, culturally safe and effective, to improve health outcomes and achieve the Close the Gap targets. To improve outcomes for life expectancy and childhood mortality, an important aspect of women's health is maternal and perinatal outcomes. Through working with Indigenous people, the 2010 National Women's Health Policy identified that maternal health prior to conception, during pregnancy, and during the postnatal period is a central priority, as it can have a profound and long-term effects on women's own health and that of their children. It also identified recommendations to reduce disparities in Aboriginal and Torres Strait Islander health outcomes.
The Australian government acknowledges the limitations to the implementation of best practice for women's health and well-being. This is due to the scarce quantity of established evidence-based practice for Indigenous females. Current initiatives aim to establish best practice for antenatal and postnatal care, which inclusively targets social detriments of health in Indigenous women. The key aspects shown to improve Indigenous pregnant women's well-being involve acknowledging the importance of cultural safety, the need for community services, and employing culturally competent and diverse staff. Practice measures which have been implemented include the following. It's been identified that the social detriments of health cycle can impact pregnancy and child health. While low birth weight, adolescent pregnancies, and adverse lifestyle choices are of concern, these outcomes are related to poor maternal health, low socioeconomic status, and stigma in the medical system. Best practice approaches which have been implemented and evaluated with good effect include the continuity of care model. The continuity establishes trust, creates destigmatizing environments, and aids in maternal health. The evaluated midwifery group practice maternity programs were shown to improve appointment attendance, screening, and smoking cessation rate. There's been positive influence on lifestyle behaviors and has received positive feedback from women about the services and their engagement rates. Postnatal care standards are still evolving and is a poorly understood area due to vague or insignificant research results. There has been difficulties with effectively evaluating the care being received, thus no postnatal care guidelines have been published. The National Health and Medical Research Council recognizes the need for changes within the culture in maternity services which harvest trust and respect. The Nursing and Midwifery Board of Australia and Royal Australian and New Zealand College of Obstetricians and Gynecologists underpin holistic and women and family-centered care within their code of conduct and professional frameworks. While postnatal management frameworks require development, the professional standards acknowledge culturally diverse and disadvantaged groups. The Australian government identified Indigenous-specific principles requiring improvements in postnatal care. The Closing the Gap strategy highlights the successful methods in reducing women's health disparities. Some of the approaches which have been successful include: to enhance future practice, foundational aspects for initiatives should include cultural awareness and cultural safety training in order to provide appropriate and safe care to the Indigenous population. Initiatives should promote and value Aboriginal and Torres Strait Islander people's culture and cultural identity from a local to national level. This can be recognized by investing in culturally capable and competent staff. Lastly, ongoing evaluations of practice to determine efficiency should be implemented to establish and fund evidence-based best practices.